a patient presents with hypotension, altered sensorium, neck veins are distended. Which of these is the least likely cause of an elevated JVP or an elevated CVP? Now understand, whenever there is a shock, one of the types of shocks is hemorrhagic or hypovolemic. Okay, typically like a patient with a road traffic accident, if he has a hypovolemia because of bleeding, this hypovolemia will cause hypotension, but it will also cause a fall in the JVP. Right, it will also cause a fall in the JVP. So normally in hypovolemic shock, the neck veins are collapsed. It goes without saying, your net blood volume reduces, so neck veins will collapse. So hypovolemic shock, neck veins are collapsed. Can trauma cause other types of shocks? One other type of shock is called as obstructive shock. You know what is obstructive shock? Best example, tension in pneumothorax. In tension pneumothorax, the mediastinal pressure increases, the intrathoracic pressure increases, it compresses the SVC because of mediastinal shift. SVC gets compressed, heart does not get filled. Heart does not get filled, you get hypotension and shock. That is called obstructive shock. But in obstructive shock, because SVC is getting compressed, the neck veins are going to be filled because they are not able to empty. So in obstructive shock, JVP will be increased. Other cause of obstructive shock, cardiac tamponade, massive pulmonary embolism, all of them cause obstructive shock. In cardiac tamponade, the cardiac filling will reduce because of blood around the heart. So again, the neck veins will be distended because the neck veins, the SVC cannot empty. So there also JVP will increase. The third type of shock is cardiogenic shock, where the heart is having some illness like a massive myocardial infarction. In cardiogenic shock, if the heart is not able to pump, you call it pump failure. If the heart is not able to pump, it's very simple. The neck veins will again be dilated, the JVP will be elevated because the emptying will be reduced. So even in cardiogenic shock, you can have an elevated JVP. Right. The fourth type of shock is neurogenic shock. Actually, it's a type of a distributive shock, which can be seen in spinal cord injury. In neurogenic shock, there is going to be peripheral pooling.